Good morning.
Good morning. So I'm coming to you from Tulum, Mexico, even though I'm usually based in Los Angeles, and you are like clear on the other side of the world. So,
It is nighttime here for me. I'm over in Indonesia. I left LA about a year ago, and I'm here with my partner, and we've been riding this thing out and planning our next steps. So,
wow, that's amazing. How long have you been in Indonesia for? Are you in Bali or?
right, yeah, we're in Bali. We took a trip around to New Zealand for like all of like the beginning of February, and that's when everything was starting to shut down. And
Did you get stuck in New Zealand?
actually, well, that's actually when everyone was like nervous, and so I actually had plans to come back to LA and treat people, and I had about 30 clients lined up, and I had to cancel on all of them. Like I was halfway,
Wow.
I was in the airport in Singapore, and I had to turn around and cancel everybody and make it back to
Wow.
Indonesia. Yeah, it was a nerve-wracking time. So
What was
God has a
going through what was going through your mind as you had to like completely change your plans halfway through the journey back to LA?
yeah, 1,000% intuition. And when I tell you, like, it was like a matter of hours, like before my flight was leaving, and I'm looking at my phone, I'm watching like when Donald Trump shut down everything, and I didn't know if California was going to be shut down. And I was just like, well, it's either get stuck in that or get stuck in Bali. And I said, well, I think I know what the answer to that is.
Hard decision, right?
It was actually my father. My father was like, "Yeah, you would be like." I was on the phone with him in Singapore. He's like, "You're dumb. Don't come here. Like, turn around."
Well, it's good that you listened.
Yeah.
Wow.
Yeah.
Well, okay, amazing. Well, here you are in Bali. Here I am in Tulum, and yeah, I'm really excited to chat with you today about your program and trauma informed body work, and just
Yes.
talk shop a little bit, debunk some industry myths, fire us up,
Yeah.
coming in hot.
I'm excited to do that with you. I'm excited to meet you in the space because we met last year, and I was like, oh, that's someone who takes their craft seriously. That's someone who understands the body tremendously, and so yeah, I'm definitely excited to talk this shop with you.
Thank you. Um, I mean, so I guess should we introduce ourselves for people who don't know you and your people who don't know me? Just say who we are, why we're here.
Amazing, yeah, definitely.
Yeah, why
Yeah.
don't you go first? Because so that way people can hear about your program and stuff too.
Okay. Yeah. So the short end of it is I'm a trauma informed body worker. I have been doing body work since 2012, where I was out of physical therapy, physical therapy education, where I was trying to avoid the insurance chase, and I saw that working with hands was something that was done in a 5-minute period, and I was like, I can't. That there's something more to this. I think that people deserve a long treatment. I think people deserve to be put down and relaxed. And when I saw the validity of that, I got into this. I got into body work. Fast forward down the line, I'm reading polyvagal theory. I'm reading these complex books on autonomic nervous system and autonomic response. And I said, I think I need further training in this. And so I went the trauma informed route. And, you know, ever since then, I've been trying to merge mind and body, especially in like a 90-minute treatment. Like, how do we create like that bubble, that atmosphere of taking somebody through a body process, and how are we now able to speak to that? It's like an art. It's beautiful. And like, uh, and then my passion is teaching, so I moved into the teaching realm, and been here since. So your turn.
Incredible. That's an amazing journey. my journey is similar but different. And so I got started actually in the yoga field. My training is in yoga therapy, and I did 3 levels at Royal Marymount University. So my initial interest in yoga came about because I was dealing with my own autoimmune digestive health issues. And even though I was seeing the best doctors, like nothing seemed to work until I found yoga. And that led me to a lot of lifestyle changes, getting healthier, which then led me into remission, which then led me to question why that worked when nothing else did. And then I went really hard and nerding out on that and ended up in, yoga teacher training and then yoga therapy school. And then I was starting my business around the same time too, while I was in school, just so I could get the actual experience in working with students. And I was seeing that there was a lot of gaps between what I was learning and what I was seeing with my students. And the way that I look at my job is that I should just learn as much as possible to help my students the most that I can. So that led me to take a bunch of other trainings, including my massage therapy certification, including joint mobility and rehabilitation specialization. Sorry, it's my morning. I'm still waking up. Basically rehabbing mobility. And then I started to see a pattern in the students that I was working with, and that they would confide in me about, their intimate and romantic lives, their sex lives. And so I started veering into the territory of sexuality too, from a somatic lens. So I offer the movement and bodywork, manual therapy, and also coaching within that realm. So they all work together. And a lot of my students have some kind of trauma, which is why I was really interested to speak with you and interested in your work, because you see a lot of like massage providers out there, but not very many of them are trauma informed. It's a very specialized skill, and it does take a high level of not only personal awareness and integrity to work with that kind of, to provide touch-based therapy for a traumatized population, but also to be able to speak to it eloquently and understand both the energetics of it and the science behind it is not something that you see very often in our industry. A lot of people usually head towards one end of the spectrum or another, which is why I'm really excited to chat, because I feel like we're very much similar in the sense that we like to combine both together. We very much take like an integrative approach, and you said mind-body connection. And so I'm interested to talk about, how do we both approach body work, because I'll usually use it more at the beginning of my work with my students because it helps to develop rapport, it helps to get them to trust me, and they also have more immediate pain relief so that we can do some of this deeper work, whether it's an injury in their body or, embodying more of their sexuality and being more comfortable in that. So how do you approach, what is the difference between a trauma-informed bodywork session and a not trauma-informed bodywork session?
Yeah, so a trauma-informed bodywork session is a person-centered, client-centered approach. So we're creating a safe haven, first of all, like you said rapport, you said professionalism and being able to like stand in that. We're creating that off the bat so that someone is able to like have total comfort, have total reliability in you as a practitioner. And from that base plate, they're able to feel comfortable in session with you. But then also the other half of that is the individual, the practitioner is trained in deep neurobehavioral response and seeing clients as they shift like in very subtle ways. Like I'm sure you are experiencing like changes in prosody of voice, changes in facial expression. So all these are like minor cues as to, what is the state behind the story. because people will tell you a story, people will tell you a narrative, but we're able to watch their state change, which is what trauma is in general. It's a changing of neurological state. It's not necessarily the story that someone wants to tell you. So it's a training in recognizing story over state, and being able to stand in that as a pillar of presence and a pillar of knowledge base for that individual to feel comfortable in guiding them through a body process. Like we don't get guided through body processes enough. Like we don't have that person that's there to, you said you graduated Loyola Marymount. I'm sure it's like was it trauma informed yoga?
Yes.
Was it that program? That's like an amazing
Yes.
that's an amazing program, by the way. Like that, like
you.
that's one of those foundational programs. So I'm so awesome that you were a part of that.
Thank you. Well, I have to disclaim a little bit. I did 3 levels of 4 levels, and then the 4th level I was in, which was going to be the clinical internship. They changed the requirements that year, and I was about to be grandfathered in, but then it would have cost me like a ton of money to finish out that certification. And at that point, I had already, started my practice and was kind of veering into other territories because.
Right.
At that point, they were saying things like, you need XYZ certification to do this. And one of those, actually, this is why I went into massage therapy in the first place, is because they said you can't give adjustments without having a credential to touch people. And I was like, well, I think that's a little extreme. There's a difference between like a quick adjustment and like really, but at the same time, there's a validity to it, because if we don't touch with a trauma-informed approach, especially if you're just teaching vinyasa to a large group population, you don't know who's coming in with trauma or not. You don't have the luxury of that one-on-one attention, going through a whole intake with them. And so you just don't know what you're doing with that touch. Right. There's no way to know for sure. Generally this kind of touch will yield this kind of result, but that takes a very refined approach that you just can't offer somebody in a classroom. So that's literally why I went to go, and all that stuff. This is around like 2017, 2018. So that's also when all this stuff was coming out in the yoga world about these gurus, Patapi Joy, Bikram, there's John Friend, like there's a whole long list of names, unfortunately, of like really well-known.
The guru, follow the guru. Yeah.
So, here's me like in school starting my business and, coming into this industry, looking around me and be like, I don't really want to be a part of this, to be honest. And I actually really want to differentiate myself from that in the sense of offering, like you said, safety, and really trying to take a legitimized approach to offering these principles, because unfortunately, in a traumatized population, these are vulnerable people, and that vulnerability attracts in that kind of like ego presence of like people who feed off of that vulnerability are attracted to that kind of power exchange and dynamic. So there's like
that's a dangerous place. That's a dangerous place. Yeah.
So, I mean, given the danger of trusting someone with your trauma, like we have to recognize there's a risk, even if the risk is an emotional one. That risk is still pretty high for people, especially if you've had severe trauma, especially like sexually, for example.
Right.
And yourself being a male massage therapist, I'm wondering if you can speak to that dynamic, like, between gender, between provider and recipient, between giver and receiver a little bit more. Like, how do you approach that from a trauma-informed lens?
Yeah, it's just, I mean, I'm sure it's being aware of boundaries and being aware, like being absolutely like sound in boundaries, and being aware of power dynamics, and being aware of attachment dynamics, particularly with somebody that is, in, I guess I could say the lost puppy state sometimes, but it's like, where am I looking for that home? Where am I looking for that home? Sometimes people are coming in like that. So it's just being aware of like, what kind of power dynamic am I trying to avoid? I got to remember, in particular, like, what is this person's relationship to touch? That comes within the questionnaire, is like, what is your relationship to touch? Like, what's your history with it? Like, what's your history with seeking out body workers like I really want to get like a strong knowledge base on that. So, you know, it's being aware of the interview process and just gauging where someone is comfortable on the levels of touch, and basically taking it away from me being the male 6'4" body worker in the room. And it's like, I'm going to put you back into your power, back into your control of the environment, back into your control of the session. Like, I want you to tell me like everything you're like to the client, like metaphorical but I want you to tell me what your relationship with this is, so that we can, you know, build a therapeutic alliance.
I love that. And it's ironic because, you know, it's really the receiver that's in charge. The client, the person who's going on the tail, I call them students. And at the
Right.
same time, we're here saying like, I'm going to guide you through this experience, when they're kind of leading it the whole time. So it really is not, it's interesting because to put somebody back in that position of power, sometimes it benefits to take more of a leading role, and other times it's more beneficial to let them guide the experience. And so like, how do you know when to do what? For me, like you mentioned before, I really try to attune to that person's body, their breathing. And what I adopt is like the red, yellow, green system, which seems to work kind of anytime it comes to humans and like establishing boundaries, you know, whether we're negotiating like a BDSM scene or we're negotiating touch. I mean, it all comes down to like the principles of consent, which are extremely important. So like, how do you recognize a somatic red, yellow, green, meaning a body response? Because sometimes when people have trauma, they aren't able to express what that boundary is until it gets crossed. And by then it's too late, right? And because then you have to backpedal and reestablish the trust. And sometimes, you know, they don't come back, right? So how do you navigate that in your body work, and what are some signals that you look for?
Yeah, I look for long pauses in conversation, or like registration. So if it takes somebody like a hot second and they're like trying to register what you're saying, it's like, okay, you may need more explanation on this, or you may need more explanation on this to feel safe. So I have like this varying degrees of explanation that I'll go into, just to, you know, if I see someone short of breath, if I see somebody, you know, generally hesitant, even on the table when they're face down, it's like you get that ping that you have to explain a little bit more, or you know, take a step back so that they can get a better perception of what you're going to do. You know, generally you want to set that up before the session, but you know, it doesn't always get that way. Sometimes the session's underway and then you just have to navigate. It's like a back and forth, right? So, or for me it is. It's just it's like a game of ping pong, you know. It's like a back and forth. So so it's like, yeah, so we're swimming in this. We're noticing subtleties as they arise. Yeah, generally like a hesitation in breath, or any sort of long pause is what I'm looking for, where I might need to go deeper. That would be a yellow light, and then to get to a green light would take more explanation for the person.
So are you constantly talking your students through your process as you're doing body work on them?
No, I want to ask them questions as to what they understand about my process. So in the interview process, I'm listing off what I do, and then I'll ask them if they understand or if they need a deeper explanation. And this is just like usually the first time. And you know, varying degrees. Some people are like, yes, like, get me on the table. And then other people are like, I need to know more. Like, I want to know how this applies to me. You know, some people will come in with their narrative. I was abused. I have, you know, I've suffered a traumatic car accident. etc. So they need a much deeper explanation. So that's what that interview process is good for. And always asking questions, always asking permission. Implied permission is also okay in certain times where someone's like, yes, I'm here to get treatment. I'm here to get that body process. So it's an implied, there's that implied
consent.
Consent and implied permission.
Yeah, I hear what you're saying there. I think for me, I also go through an intake process. I'm pretty thorough with that. And then I think just beyond, the actual dialogue and conversation too, I think just, to be honest, I feel like it's a lot easier for me to convey safety through touch than it is through words.
Yeah.
And that's because touch is so much more primal to our understanding and our nervous system understanding than words are. Like language is a later development in our evolution from the time that we're babies. One of the first things that happens is you get held to your mother's chest, or you have physical contact, and that's the reassurance that creates that feeling of home. And I think our hands in particular have a heightened ability to convey meaning or emotion or safety even as well too. So the way that I approach, because some areas may be green and other areas may be like super red, right? So you may not know that until you get there. And sometimes it can shift over the course of one session or over the course of several sessions.
Yes.
And so the rate of which that I will go and push somebody's boundaries is dependent on that student. And I'm not trying to push boundaries to trigger them. That's something that really honestly triggers me that people say about body work, is that I'm not triggering anything to try to evoke a certain reaction from my student necessarily. I'm creating the environment in which their body has the appropriate level and the appropriate inputs to facilitate its own change.
Totally.
Because I'm not going to outsmart somebody's nervous system. You know what I mean? So
absolutely, it's like the wisest process we have. And when we induce a change, when we induce like a new proprioception that is unfamiliar to the body, it is a challenge. It is an agitation of the nervous system in a way that like the somatic nervous system is going to rebound and be able to recognize a new like feeling essentially, or a new like being. I experienced a new body because of this process that I went through. And I think that when people say that you have to trigger the body, I think that's a mix up of words with agitation. I don't think that's an appropriate like thing to say. Because triggers are a massive, that's a massive amount of energy towards emotional shift. And to say that you're doing that is probably the wrong verbiage to use. We're trying to help people manage stress states so that they're better able to manage triggers as they happen. They're better able to feel safe in their own skin and their own environment. Triggers are not the agitations that we're bringing forward. Right. They're the ones that we're helping regulate.
Right. And it speaks to this. I think a lot of times we think about, trauma is a cyclical pattern. It's something that remains unprocessed in our somatic experiencing. And so it's a looping and it's a pattern. And sometimes we can't get ourselves out of that, or sometimes we don't even have awareness of what those patterns are. We just know that we don't feel the way that we want to. And sometimes we can't even describe that. So, body work, touch is one of many ways to give new inputs into the nervous system and actually agitate it so that we break that cycle and create a different enough reaction for a long enough space such that we can start to create new patterns in the body. So I don't agree with this approach of we're going to trigger you and then you're going to be healed and then everything's fine from then on. You have to keep all the
Yeah.
time, right? Oh my God, it really pisses me
You see,
off. But
you
I'm
see,
gonna get on my soapbox.
you see that. I see that in body breath work a lot. I see that in the breath work circles. That is just like, we like, let's ramp up your nervous system so that you can get all the trauma up and out and breathe it out. And it's just like, oh man, I really hope you guys know what you're doing as far as like creating a container, because you send people off into autonomic dysregulation, which is like just trying to balance the like the amount of oxygen that's coming in. It's just like we go into this like rebalancing, and that can cause tetany, which is like the shortening of arms, and that can cause like the base to flush, and it can be a big process. And then like you're left on a sofa, like, or like you're left on a pillow to go process that on your own, and then you get up and you leave the circle, and it's like, what just happened?
Yeah, there's no integration.
Yeah, yeah,
And
and then it's like,
it's too much input.
and then someone will be in a corner saying, yes, just process that. Yeah, understand your trauma. It's like, well, I had a whole bunch of shit pop up, so it's you see that a lot in the breathwork circles, I think. Yeah.
Yeah, and many circles. And
Yeah.
yeah, I think it's really, really important when you're working with trauma to give the right inputs at the right time in the right amount. So for example, I might know that somebody, I mean, let's just take a really easy example, which is like working with a shoulder injury, right? Just, I don't know, somebody had a sports injury. Okay, so, and I've actually had several clients like this where they can't even move their arm like here to
Yeah.
here with my assistance. And so, I
That's
mean, they
me.
came,
That's me currently. Actually, I
oh,
just
really?
suffered an injury, unfortunately. Yeah.
Oh my goodness,
Yeah.
what happened?
I got electrocuted. My arm came out of its socket. So yeah.
You got electrocuted?
Yeah.
Was this in Bali? What happened?
This is in
You don't have to
Bali.
share
Yeah.
if you don't want to.
No,
Maybe that's another
it's good.
podcast.
Yeah, that'll be another time. But when you
Okay,
said that, it just reminded me. But yes, so I know the feeling that they have to go through. But
right.
yeah.
Well, that's so funny. I just like intuitively picked up on that and like chose that as an example. But anyway, so I'll just speak in generic terms then. So when I was working on this other student in particular, he came in and said that, I can't move my shoulder this way. That's just how it is. I had this accident and it's never been able to get better. He said, I've seen several physical therapists. And I was like, okay, well, maybe I'll work on it a little bit. How do you feel about that? He's like, okay, you can try. I mean, we'd been working together for a few months, so we already had that rapport established together, and he trusted me with my knowledge in general, but we hadn't specifically gone into this area yet. So I just started working it, like moving it back and forth, just rounding it. And then you see, because you're going into a space that's saying, okay, after you get injured, the nervous system tries to hug that part of the body closer to it. And so if you
Right.
try to take it around, it's like, whoa, 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 what are you doing?
Right.
Right. So the nervous system has to feel comfortable owning those spaces and owning those ranges in a passive range of motion before he's able to actively do that on his own. Right. And so that's what I was trying to do with the shoulder. And so I don't go into people's places of injury immediately. I feel like that's really disrespectful to the
Right.
body. And if like it's like poking a bear, that space is pissed off, it's agitated, it's got inflammation, it has history. So you don't just go right into it really, really deeply, like you were saying, as the breathwork circles do. The way that I approach it is I work around that space and I release all of the secondary or kind of like auxiliary muscle groups. So for the shoulder, it's like working in the neck, working in the subscapes, working under the lats, working into the pecs, working into the arm, and then I will go into the shoulder. And so people are like, why aren't you working on my shoulder? I'm like, I'm just not going to do it right away.
Right.
And if everything around this space is relaxed and open and letting me touch and work into it, I have that much more room and likelihood that this space will also respond to me, even if there's a little bit of initial agitation or a little bit of yellow flag stuff coming up at first. And what I ask them to do, where I coach people through, is the breathing. And so I'll say, okay, can you just try to breathe into this place a little bit? I see that you're holding into your low back. Can you just soften that a little bit for me? And I'll just hold my hands there until they can find their breath again. And then I know I have permission to keep going into that space deeper. Okay. And then we just continue that process. And maybe we get to the space we wanted to get to that day. Maybe we don't. Maybe that's the next session. So I always want to get through as quickly as possible, because I'm not trying to, I think people unfortunately have a lot of bad experiences with other providers just trying to drag out a process to make a bunch of money. But especially with trauma, and for any students who are listening to this and have trauma, I want you to give yourself the blessing of time, so that you aren't trying to do everything in one session and titrate it, so that you only take off as much as you can chew in that moment, given everything else that you have going on in your life. That's also important to consider. And then proceed accordingly, right? And it takes a really skilled practitioner to know and ascertain what that right level is, to both keep you moving forward and give you enough time to integrate, but also give you enough time and space to process what's coming up and really feel it into your body without having to, because rushing that process is its own form of trauma.
Yeah, absolutely. Yeah, I mean, trauma is a robbery of space and time, and our whole goal is to give it back, and give it back like in as many doses or as earthly acceptable, like, to that person, because if you try to rush that process, it's like, the client will full stop. It'll be like a full stop. It'll be like a hard no. And back to that withdrawal state that you were describing, like that tightening up. Our bodies actually default to flexion. Our bodies default to withdrawal, just as a protective mechanism. We even have a reflex in our body called the flexor withdrawal reflex when we touch hot things and we back away. Like, that's ingrained in our biological process. And so when it's a full no to something, it's like we tighten back up.
There's a contraction. And I think you see that across the animal kingdom too. I mean, think about like a cat that's scared, it immediately goes into hyperflexion.
That's it. Yeah. And it uses all of its body to jump. Like, it'll use all four legs and its psoas to like get out of there. And we do that, but we override it. We do that, but we don't know we're doing it. Like, we'll do that if we're sitting in traffic in LA, we're doing that, but somehow we're safe in a car, quote unquote. And we're forgetting that daily commute is compounding, and we're actually taking that on. And that's something to consider when you're looking at complex PTSD or somebody that has compounding trauma over time. And I'm, by the way, also not saying that everyone's traumatized. That is a huge misconception. Like, just by talking about trauma is like, it's just a part of life, but not everybody is ingrained in this state. It's a changing of your neurological state again. So it's important to just recognize what people do go through when they are in trauma, and what little things throughout their day could be causing that, like withdrawal, or that like painful sequence. People want their pain to be validated as well. So if they are experiencing it, it's really important to say, I understand, I see that, like I see that, I feel that, or I hear that. It gets used a lot, but it has its place.
Yeah, and sometimes the healing is in just having your experiences be validated, and like, yeah, that was a hard thing to go through, and what you feel is a normal, natural, actually highly evolved response to what happened, not because you're broken. This is actually what is supposed to happen when you go through something horrible.
There's a fine line to that, though, that I'm finding, is that we need to avoid using platitudes like saying I feel you or I hear you, and then just letting that go. and just letting like that be open to interpretation. We can always say, I understand that experience because, or I understand what you're going through because, or I see that that must have been tough for you. But you know, there's people on the internet nowadays, like Instagram, that are saying, I feel you, I see you, this is the way. And it's just it's like a worthless platitude sometimes. So there's like a fine line between,
Mm-hmm.
you know, validation and then just throwing the word vomit out there.
Yeah, it needs to be something of substance. Like there needs to be, like you said, a certain earthiness to it. And there's a process of homecoming here, a subtle process where you're restoring that person to themselves. It's not that I'm coming in and fixing anything. That's the ego side that we're talking about. But it's, you know, and it feels empty. It's a nicety to offer that sentiment, but it's just like, oh, I'm sorry, you know, but there's nothing really backing that.
Yeah.
And so for them to feel that substance, to feel that earthiness, to feel that density and be able to fill back up within themselves again, I think is a really difficult thing for a lot of people because it's such a rare thing to find in society, and not very many people know how to really give that, or in the place, especially now after such a year, to offer that kind of care, to offer that kind of compassion. It's almost like you need to know what that feels like in order to offer something of value in that circumstance. And it's hard when people don't necessarily relate or know how to provide that kind of context. So I really hear what you're saying, and not to
I hear
overuse
you.
it. I hear yeah, not to overuse that, but I hear what you're saying, and that what you want to provide to your students is this really safe container, and be like, okay, whatever needs to come up for you in this moment is going to be held. And at the end of that process, that journey, I'm going to bring you back home to yourself. I'm going to remind you who you are. I'm going to remind you that this is your body, for you to enjoy and work with and develop an ongoing relationship with for the rest of your life. And we can do that through relaxation. We can do that through this approach and retreat type strategy where we're not just powering through everything, which is how trauma happens. Trauma is when there's too much load for the capacity at the moment, whether emotionally, physically, just too much, right? So we're going to strengthen your ability to self-regulate. We're going to strengthen your ability to communicate boundaries. And if that means being able to push past a boundary slowly, or open that up in a way that feels safe to you, and that's the healing, great. If that means we may have to learn how to strengthen a boundary, and maybe it's not even like a massage session, maybe it's just a conscious touch session where we're working with, okay, does this feel good to you? What would you like me to change? And just practicing articulating that, because that's also really hard for people. So like, you know, in some sessions, I will just sit across from my student like this, and we'll do what I call like a conscious touch exercise, and we'll set the bubble by like, you know, it's only us two here. Let's take things out of our bubble that we don't want, and let's call things into our bubble that are going to help us in this experience. So we can remove fear, we can remove anxiety, you know, we can call in grounding, we can call in whatever the intention is appropriate. And then we'll start very simple. Like I'll just put my hands out and I'll say, okay, I would like you to just place your palms over mine, right? And we'll do that for a few seconds. Okay. Then it's their turn. What would you like me to do to you? You know, it's like, well, I would like a hug. Okay. You know, and then we just go back and forth, and there's room for it to escalate and there's room to de-escalate. And I'm guiding that process the whole time. And the practice is saying yes and no. And like, okay, this does feel good to me. Can you actually keep doing that? Like, yes, I can actually. Or no, that doesn't feel good for me to give right now. Maybe we can do this instead. So there's a back and forth dialogue there. So that doesn't happen in every session. It's just like, it's one of the many tools you can pull out, but it is still a touch-based practice.
That's a fantastic sensory integration tool. And like, and I definitely wanted to ask you, like, I know you have like, I know you probably have a battery of like resource tools that you send people away with, or that you generally recommend, like aftercare. Like what's a favorite of yours that you're sending people away with that is tangible on their home turf, like when they're not in session with you?
That's a really great question. And actually it's not like an aftercare thing for me. It's that's the whole practice.
Yeah.
So like I said, bodywork is one of many modalities in my arsenal. And so we may use part of that as a tool within the scope of our practice together. But the whole idea of me working with my students is that they're able to consistently integrate and adapt their own personalized practice that keeps them regulated. So whether that's breath, movement, self-massage, rolling out, certain meditations, guided, embodied inquiries to help them connect with their sexuality. They always come away with a practice that's personalized to them. So they know it's exactly what they need. It's me guiding them through it, and they'll have a recording of it. So again, it keeps us in that container. I'm not sending them to like somewhere else. You know what I mean? So they feel like, okay, I can just watch this video or do this practice and it's for me, and this is going to hold me over as a tool when I need until the next session. And then the goal over time is that we strengthen that student to the point where they can ideally self-regulate or have the strength within themselves to face whatever it is that is going on and cope with it and really manage themselves successfully in their lives. So I don't know if there's like one tool. I would say probably like breath work is going to be one of the most important, but also one that gets passed over quite a bit in just regular day-to-day practice. But
Yeah.
I think in terms of trauma healing, probably the best tool I can give somebody is to teach them how to give themselves more space in their day-to-day life. Extra buffer, just space to come back home to themselves, whatever that means for them. So just space to create their practice.
Internet via a cable outside and got electrocuted. Yeah.
Oh no. Oh. The things we do for internet. I'm sorry, I don't mean to make a joke about your arm.
It's really fun. No. Actually, now that I get to, if I can talk candidly about it, God has a weird plan sometimes, and the second that I move an entire learning platform online is the moment that he takes me out of the bodywork room or something like that. He or she, or I mean, like God, right? So yeah, so I'm just like, oh, this is I have to listen, I have to listen to whatever is out there telling me to slow down, because yeah, it's like a transition. Like I'm moving out of the room and into a platform. So pretty crazy stuff, huh?
Yeah. Well, that's amazing, because then you can take that experience in the room and, it can have a wider impact because you're helping these other providers who are still working with students and still offering that touch in that container. And it's only going to enhance their experience and, help heal more people. So I think it's amazing what you're doing. I'm sorry that it came about in such a electrifying way. But sometimes the messages are strong from spirit. No, it's just like, hey.
Just calling it in, right?
Yes, okay, I'm listening. I'm sorry.
I'm listening.
And I find that's, there is a message underneath the trauma, and so often that's the process of homecoming, is just listening to the messages that are there and that we're kind of avoiding. We tend to, or at least the students I work with tend to have an avoidant relationship or dissociative relationship with their body, where they're always coming like up and out of themselves.
Yep.
So it's very difficult for them to anchor back down. Like, working, I worked with a few vets before, and anytime I'd work like around their heart or back of their shoulder, like around this space, it was just, there was a lot of guarding there.
Right.
And for good reason too, like that's their training, they have to just put that aside to be present in the moment and to execute on whatever it does. But again, that takes you up and out of your body, and
Absolutely.
it is a sort of trauma response, and so just to reclaim that space of your body is so revolutionary and sometimes painful and sometimes extremely overwhelming and scary too.
Yeah, we see that in many professions where we're gearing people to be making decisions and making decisions all the time and making high pressure situations, high pressure decisions. Sales jobs, like even sales jobs all the way to military. So it is pervasive out there where we have people in their mind thinking and executing, and that takes them up and out of their body experience. And then 10 years down the line, it's like, oh man, where have I gone? Where am I? Like
They lose themselves in it.
Yeah, I'm having some health scares. I'm having some health problems. Like where did this come about? And where can I get intervention? And that's where I think like we got to talk about, I think we need to destigmatize the massage industry as a whole. Is like we're not these workers that are just like, to be tossed to the side. Like this is an essential profession where with more talked about outcomes and more training for providers and more safety in the pay structure and more availability of I guess safety from like the boards and all the boards, like the certification boards and et cetera. I think that there's room for us to change the stigma surrounding touch, because we need to bring this out. Like everyone's going to be, a lot of people are going to be in touch deprivation, touch starvation, and this is a perfect
Especially after the
opportunity.
quarantine. Yeah. I mean, LA's going into, they're in another lockdown right now. So
this is going to be a perfect opportunity to say, hey, look, this is a profession that is a long time coming. We need to recognize the value of touch therapists out there, and they need to recognize that value inside themselves. So like, I really hope that this is kind of a shift in that direction.
So that's amazing. I'm curious to hear like what, if you could change, maybe 3 things about the stigma in the massage industry, what would you change, or what would you like to see differently specifically?
Yeah, the acceptance of practice for long interviews and exit strategies. So creating like 30 to 15 to 30 minutes before and maybe 15 minutes after a session, so that a practitioner can run down exactly what they did if the client's comfortable. I think that's just not permitted. we're rushing people through. I know I've been in a massage session where the person's like, hey, can you get out, because I got the next person coming in. So that drop in professional standard is probably number one. That is like, that's a huge stigma bearer right there. People get that assumption that the therapist is not a caring entity, and so I would absolutely change that. Yeah, I think there's a lot of the need to delineate from the sex work industry, but also understanding that we are sexual beings, and that there would be a realm for that particular type of therapy, as long as someone is absolutely like a standard of care for that industry. But there's still a need to delineate the touch therapist from the sex industry, I think. So I think that's number 2. And yeah, and
I think a lot of people, to your second point there, I think a lot of, because I coach sexuality and I'm a massage therapist. So, I have a lot to say about that.
Yeah.
I won't get into all of it now. But so I think actually the sex industry world might even agree with that, because in true, true service providers and the sex industry are going to have extremely clear boundaries about what they
Absolutely.
will and will
Yep.
not do. We're actually the same. And so it's just that we will or will not do different things,
Yep.
right? But I think it's absolutely a tryst to the therapeutic relationship to go there and insinuate those things without there being a clear container around it.
Yep.
So, you know, I have had to fire clients before because they've asked me for that. I'm like, you know, I'm happy to support you in that journey, but I'm here to return you back to yourself. And to
Yep.
be honest, a hand job is not going to do that for you. It's actually just going to confound things even more.
Yep.
And it's
Yep.
not really going to solve any problems for you. Also, it's extremely disrespectful to me. So we're done here. But
yeah, you have made one assumption too far. So
yes. And so I think it's really, I mean, people still mix things up that a masseuse is not a massage therapist. And I think even the terms confound themselves in the sex industry and the massage therapy industry. I've always had this like complicated relationship, because if somebody would want to set up an illegitimate practice, a massage therapy business is probably the simplest way to go. And so I understand the reason for it being there. I understand why it's that way, but unfortunately, I think you can tell really clearly what the intention is by how somebody sets themselves up as a professional. Do they have an intake process?
Yep.
You know, what kind of container are they setting? What is their training? Like, what is the feel of the place that you're going to? You know, there's a lot of signs and symptoms there. And so I think you cannot fundamentally separate touch from sexuality. Sometimes students will have a sexual response in sessions or get aroused, but that is different than it being a sexual session. You know what I mean? There has to be, like I said, a clear container, and there has to be a clear purpose and reason for that space, you know, and bringing in the aspects of sexuality can definitely complicate that space infinitely. So you just have to be super, super careful and super clear. Like even so to give a specific example, going back to that conscious touch exercise, you know, it's, I, as a provider, I'm holding the space for everybody. So I've been asked things where they'll be like, oh, can I do this or that? Or can I touch you here? And I say, no, thank you. You know, that's my boundary today.
Right.
Or, you know, my boundary with this person. And, you know, I feel like we're not there. That's not where we're trying to go. And I appreciate you asking. But no, we're just going to settle right back down, and then I'll bring it to something really basic. So there's space for that stuff to come up, but it's handled in such a way where it's like, okay, it can come up, but it doesn't have to go anywhere.
Right.
Does that make sense?
We don't, it's within my boundary, and we can let it process. Like it's like allowing the natural occurrence of things to happen, and then not having it like skyrocket or go off into the distance. Yeah. I hear you on that.
Yeah. I mean, we're talking back on power dynamics now again, because it's like, you know, I mean, some students have said like, oh, I'm attracted to you. I'm like, that's interesting. Let's explore that. You know, like, what does that bring up for you? What is, you know, we'll have a conversation about it. And then, you know, if it's just an attraction and that's all, it just is stated and then it's out there, it's fine. You know, It's not going to go anywhere, but it's almost better that I know. And so I appreciate them being honest with me, because then I will be more sensitive to that boundary. Whereas like, you know, you may be working with a female student who has had history of sexual abuse by another male, that might be a really big boundary for her to breach, and also part of her healing. And so we might be offering for that person for the first time in their lives or in their recent history an opportunity to see that it's okay for these things to be brought up, and we're going to work through them in a mature, consensual way. And so we are demonstrating those behaviors. So it's really challenging as a provider to hold that. And I think when you go through massage therapy school, you're not really taught any of those things. And so most people don't have like the self-awareness to really like stay anchored within themselves and within that space, because I guess temptation can just take over, or just, it's a tricky space. It's a tricky space. But I think absolutely holding that structure and that clear container and onto that therapeutic purpose and healing intention is where I find myself very solidly anchored.
Cool. Well, Let me pivot one on you. What do you think of power dynamics and touch, and like all the racial tension that has happened, like and like, you know, all the gaslighting that may have been experienced through a presidency? Yeah, like we're I think we're foundational in helping people process that. And also,
Yeah, thank you for bringing that up.
yeah, and also we need to be aware of, like, in a different way, as a white man, I need to be real understanding and sensitive to something that I have absolutely no experience in, or no uh, uh, well, I'm talking specifically about race dynamics, but like, you know, I would not be able to have had that life experience. So it's been a whole new level of understanding of how somebody may be processing in the treatment room, uh, and, you know, what they may be going through. So I don't know, like, maybe what's your take on that?
Yeah, thank you so much for bringing that up. I think it's such an important and relevant question right now. Probably should have been brought up earlier in this interview, but I think it is very important to speak to that. And there will be times as a provider that you are working with trauma that you haven't experienced and will not experience in your own life. You know, so we have to, as trauma informed providers, we can't always be putting the onus on the individual to heal themselves.
Mm-hmm.
It's also on the community to be able to create an environment for healing, right? And we have to be in recognition and validate that some people have been living under certain oppressive systems for a very long time, and that's certainly going to impact the regulation of their neurobiology, right? That is the science of it. And as trauma-informed therapists, we know this.
Yeah.
And so I think where the holistic industry kind of gets this wrong, even though it has good intentions, is that we'll give breathwork tools, we'll do this, we'll give massages, we'll do all this stuff, but that doesn't recognize the core of the issue is coming from generations of oppression,
Yeah.
and mistreatment. And you know, somebody may have not had the same opportunities, or they may have been taught to regard their body in a certain way or a devalued way because of the cultural narrative. So I think it's important that we be aware of that we be sensitive to it. And the best way to, in my experience, to approach that with somebody, because everybody can relate to their race differently as well,
Yep.
is that, how would you like me to approach you? Is this something that's important to you within the scope
Yes.
of our treatment? Do you want me to hold space? Do you want me to listen?
Yes.
Do you want me to get involved? Like, how can I best support you in the most meaningful way in this circumstance? Here's some tools that I have to offer, but I want to make sure I give you the right one that works for you,
Right.
not the one that, you know, and it's not their job to necessarily educate us on that, but it's more of like just giving them the choice of how they would like to be treated.
Yeah, choice is key. It's like, they understand that you're not coming from a place of judgment. You're not coming from a place of ego. You're able to see that you're able to see things in a different light based on what their representation of a session is, and what their representation of a need is. And yeah, I think that's awesome.
Yeah, so it's you know, and so it also goes back to, okay, well then we also have responsibilities as providers to be you know, aware of what's happening in our communities and in the overall, you know, outside forces, because that's not always within the person's onus of control.
Right.
It's just not. And it would be a form of gaslighting to insinuate that it is. And therefore, we are further traumatizing somebody who's already lived a whole lifetime of trauma. And so, what are you doing? You know, what are you doing? So, your role is to really help that person and to be of service. And I think if you hold that intention at the forefront and have a community around you to keep you accountable to that intention, and to be really open to feedback about how you could do that better, that's really, really important. Now, is everybody going to be, you know, the best or most ideal provider for processing that kind of trauma? No, but could could they make an effort towards a greater understanding of what those kinds of, what those people are going through and the kinds of things that they've experienced? Absolutely. I may never experience the same thing being a white woman myself, but I can listen, I can read books, I can educate myself, I can take special trainings in that. And I actually joined some, I'm not trying to like boast about the things I've done, but, just to make sure I'm holding myself quietly accountable, I've like joined some Facebook groups, I've signed up for some trainings, I've literally done all the things that I've listed off. So I don't profess to be an expert in this area. I just want to have at least a good enough understanding of what's going on so as to not further trigger somebody that would come to me for help in these areas, for example. And the same thing goes, by the way, with religion. So I need to understand what somebody's religious background is, and I need to understand what those cultural principles are. I mean, in working with sexuality, there's a lot of shame around sexuality in certain religions, and so that's part of what we're working through. So if I don't understand what the tenets and the culture of that religion is, then I'm not going to be able to help them. I'll just be like, so you have to meet somebody where they're at. You can't ask them to come to you when they're already in a place of trauma. That's the whole point of you being a provider.
Totally. And you can't assume the role of the healer, like the grand healer that you or we can't. I'm sorry. I should say we, or I even. I can't assume the role of the healer, because then it is another form of gaslighting. It's like, well, I'm assuming I know what you went through, and I did that to you. So that's
right.
That's
it's like the thing of like, I know what's best for you.
Yeah, I want that out of the industry. So I wish that just like. I wish we could just flick that off of people, like that's gotta go.
Yeah. Well, thank you for bringing up that question. I think it's a great question, and do you have? I want to keep this short because I know we're stretching it into a bit of time. But do you have any other questions for me, or I feel like we've covered a lot of what I wanted to talk about together.
we hit some ground. Yeah, it's good to chat with you. Seriously, it's
Thank you.
I love seeing you in this space and meeting you in this space. So it's comforting for me to know that especially bodywork, somatic work, movement therapy, someone like you is taking it so seriously and being able to speak to it. And so I enjoy meeting you in that space.
Thank you so much. I'm glad we finally got the opportunity. Especially with the time zone difference, it can be really tough to navigate. And I mean, you just launched your course too, so congratulations on that. Eddie's running a trauma-informed training program for body workers, which I think is amazing. Probably everybody should take. Even if you're not a body worker, if you have any kind of like touch or manual therapy in your practice, I think if you're touching people, you should be trauma informed. Like it should be just a requirement. Like you don't have a choice. Like you're going to work with people who are traumatized, and so it's really important to have this knowledge. So definitely check out Eddie's work. I think the program's closed now, but maybe you can catch the next time. Get on his list.
We'll open it again in 4 months. So the thing, just quickly, the thing about that is that trauma-informed education for body workers in particular, it's expensive and it's not accessible. So we're gonna make it not expensive, and we're gonna make it accessible to the body industry and body professionals. So that's where I'm at. That's what I'm rolling out. Is like this has to be a thing. So. Yeah, thank you for
absolutely incredible. Yes, I'm 100% in support of your mission. So thank you for including me on that. I'm happy to shout you out, all those things. So thank you so much for your time today. I'll let you get to sleep. I'm gonna go start my day.
Well, enjoy your day. Yeah, and we'll keep in touch. So to say.
And I hope your arm heals quickly too. So let me know how that's going. But much love. Thank you so much for your time, and many, many blessings.
Aho, take care.
Okay. Take care. Bye.